This video will introduce you to our team that will be with you every step of the pathway, and they will see that you achieve bariatric weight loss success.
Hi, I'm Julie Scott. It's my job to help our patients understand their insurance coverage and other payment options for weight loss surgery. We have an entire team that's dedicated to helping you through all the necessary steps. We will help you to get insurance approval, get ready for surgery, and prepare for your life after surgery. After watching this video, it is important to complete and submit your 2 questionnaires about your health history and insurance information. Our office will review your 2 questionnaires and contact your specific health insurance provider to learn what procedures are covered under your plan and what actions are required on your part to obtain those benefits.
Within 1 week of submitting your 2 questionnaires, you will receive a personalized pathway letter in the mail and all of the steps you need to take to apply for surgery coverage. Here are some important things you should know about insurance coverage. Medicare and Medicaid offer bariatric surgery coverage, but it's important to know if you rely on a secondary insurer, you will need to get approval from that insurance provider as well. Commercial insurance plans vary in bariatric surgery coverage. If you have insurance coverage for your surgery, there will be specific requirements to meet before surgery is approved. The pathway letter will help you understand your specific requirements. If bariatrics is not covered under your insurance plan, we can help you seek coverage.
It's important to remember that insurance companies do not necessarily consider the state of your health when making their decisions. They consider whether you've completed all the necessary steps in the correct way and filed all the proper paperwork by their exact deadlines. We are your partners, and we will work with you to be successful.
Hi, my name is Andrea Wolf, and I'm ThedaCare's Bariatric Program Coordinator. It is my job to help patients progress through the bariatric surgery process, from planning and preparation through surgery, recovery, and long-term support services. For most people, it takes between 2 to 7 months to complete the action items on the pathway letter. These items include dietary visits or weight loss visits, behavioral health evaluations, an exercise program, a sleep study, medical clearance, and other requirements specific to each person. Insurances with bariatric surgery benefits typically cover these visits and evaluations as well. Next, you will hear from some of our team members who are dedicated to helping you through this very specific process.
Hi, I'm Dr. Thomas Groh, and I'm part of ThedaCare Behavioral Health and a partner in helping people just like you be successful with bariatric surgery. You'll have 2 separate appointments with me. The first is an interview and testing session, and the second is a follow-up session where we'll discuss the results of the evaluation. The purpose of the evaluation is to create a plan of action to ensure you will be successful long-term with bariatric treatment. You don't have to be perfect or problem-free to pass the evaluation. In fact, if you are currently in psychiatric treatment or counseling or taking medications such as antidepressants, don't stop. Those services and medications will help you be successful with bariatric treatment. If we do identify any concerns in the evaluation, we'll develop a plan to deal with them. I might recommend that you attend the 8-session Bariatric Life Skills group prior to surgery.
Hi, I'm Chris Matula, and I oversee the 8-week Bariatric Life Skills groups for bariatric surgery candidates. Many people find the group helps them develop coping skills to address personal lifestyle habits that contribute to their struggles with weight. Some people are required to complete the group before surgery and find it very helpful. Others elect to participate because they want to do whatever it takes to improve long-term post-surgery success.
Your pathway may require you to complete a sleep study based on your health history, and this can be done at the ThedaCare Sleep Lab if it's convenient for you. You may need a sleep study if you are currently diagnosed with sleep apnea and you need to show compliance with your current CPAP machine. Not all patients must undergo a sleep study. If you're able to download information from your current CPAP machine, you may not need a new study.
Hi, I'm Lori Knapp, and I'm a registered dietitian who works with people before and after their weight loss surgery. Here are a few things you should know about weight loss and diet requirements in advance of your surgery. Most insurance plans require supervised weight loss attempts for a 3 to 6 month period within the past 3 to 5 years. We will help you determine and meet your specific insurance company rules. You can work with a registered dietitian, work with one of our bariatric dietitians, meet with your own family doctor, or take prescribed medicine for weight loss.
I'm Ashley Kraut-Kramer, and I'm also a registered dietitian. If you are part of a weight loss program like Weight Watchers or Jenny Craig, you can continue on your program, but your progress must be supervised and recorded by your physician. It is very important that your provider specifically note that your visits are for weight loss purposes. It is best that no other health concerns are discussed at these visits, otherwise your insurance company may reject them as required weight loss attempts.
It's also very important at least 2 of your weight loss visits are with the ThedaCare Bariatric Registered Dietitian. The reason is that we want you to be on a special high-protein, low-carbohydrate diet to maximize your weight loss prior to your surgery. This diet also helps shrink the size of your liver by 40 to 60% over the course of 3 to 6 weeks. Since the left lobe of your liver, when enlarged, can cover the stomach, a smaller liver makes for a safer and easier bariatric surgery.
This is the same diet you will follow after your surgery, so it's good to start learning about it early. We are very attentive to your taste preferences and teach you how to choose and prepare the right foods in the correct portion size.
It is important to begin a routine of physical activity now because it is associated with a greater weight loss following surgery. Exercise really is for everyone. No matter your age or weight, it helps you stay healthy and get the most out of life. Our exercise physiologist will meet with you at least 2 times before surgery to help you develop a plan for physical activity that can be incorporated into your daily life. You will work together, learn a lot, and even have a little fun.
Hi, I'm Dr. Steve Knaus. I am the internal medicine physician who will help evaluate and manage your health conditions a few weeks prior to surgery and during your hospital stay. Before surgery, I will review tests such as your chest x-ray, EKG, and ultrasound to look for any areas of concern. The goal is for you to be as healthy as possible prior to surgery. You may also see me for your first doctor's appointment after surgery. Beyond that, I will hand off all of your bariatrics information to your own primary care provider.
Our team will collect and review all your medical documents and send a letter to your insurance company for approval. It generally takes about 15 business days for us to hear back from your insurance company.
After you receive approval from your insurance company, it's time to schedule your surgery date. Please call us at 920-725-4527, and we will schedule the next series of appointments with you on a 20-minute phone call with our staff.
1 week before the first in the series of appointments, you will meet with our staff to go over all the appointments we have made over the phone, receive copies of the appointments in writing, review materials for these appointments, and get directions to each of the clinics. We will start with scheduling your actual surgery date first. This will be about 4 to 6 weeks out from the time that we receive your insurance approval. About 1 month before surgery, you will have your upper endoscopy. This helps us to look at your anatomy from the inside out to make sure there are no physical concerns that may require us to adjust your surgical plan. 2 weeks before surgery, you will have a full day of teaching, testing, and lab work. Next, we will schedule your history and physical. This will be done a couple of days to a week prior to your surgery date. On this day, you'll meet with the surgeon, internist, and exercise physiologist.
In addition to these appointments, you will be required to be smoke and nicotine-free for a full 2 months before surgery, embark on a 4-week pre-operative diet to lose weight before surgery, and attend at least 1 of 5 required monthly support group meetings.
Hi, my name is Sandra Santiago. I'm one of the center's clinical nurses. I will be meeting with you on your teaching and testing day before surgery, and I will see you again while you're in the hospital. Here are some things you can expect on your surgery day. The Roux-en-Y surgery typically takes 60 to 75 minutes, and the sleeve gastrectomy typically takes 30 to 40 minutes. If the surgeon sees something else during surgery, like a hernia, they will try their best to fix it laparoscopically during the same surgery. You will be in the hospital for a total of 36 to 48 hours, and the second day will be almost entirely teaching time. You will go home without a drain, and you should be able to shower. You will be on a liquid diet immediately after surgery and will return to regular meals within 3 months after first overcoming some initial food intolerances. Some common early issues after surgery are nausea right after surgery or if you overeat, initial food intolerances like red meat, milk, or sugar. These may fade over time. Vitamin deficiencies if you do not take your required vitamin supplements. Temporary hair thinning, changes in bowel habits, and depression or mood changes. You have already met with Dr. Knaus, our internist, before surgery, and he will carefully follow your progress after surgery and help you through any obstacles. Many issues that arise immediately after surgery will moderate in time. You can expect to return to work in 4 to 6 weeks.
Now let's discuss the cost of weight loss surgery. Ideally, with insurance approval, your carrier will cover the majority of your surgery costs. It's important to know what your maximum out-of-pocket allowance is for your plan, defined as the annual amount you, the patient, will be responsible to pay. Once surgery is complete, your insurance receives a bill and makes a payment. If there is a balance left over, we will help you develop a payment plan to pay off the remaining balance. If bariatric surgery is a direct exclusion under your health plan and you have no other options for insurance coverage, you may opt to pay for surgery out of your own pocket. If this is the case, you can contact us at bariatrics@thetacare.org, and we will help guide you through this process and explain the cost. If you are paying out of pocket, payment is due in full 2 weeks before your surgery date. Some people who pay out of pocket use funds from savings, a home equity loan, a 401k loan secured for a denied medical expense, a credit card, or a healthcare lending program. Our website has support links if you would like to explore a healthcare loan. Our practice is not associated with lending practices directly. We simply provide this reference for your convenience. Included in the cost of your surgery are a surgical suite, inpatient room, all staff and supplies, a required day of preoperative labs and testing, both surgeon's fees, anesthesiologist fees, radiologist fees, and internist fees. The cost of the evaluations you will need before being approved for a surgery date are not included in this list. These tests and screenings are generally covered separately by your health insurance.
You have invested a lot in your decision, and you will have to keep this commitment for the rest of your life. There are a number of lifestyle changes that you will need to make. Always eat protein first at every meal. No non-protein snacking. Sip 8 8-ounce glasses of water per day, 64 ounces total. Make sure that you're not gulping them, as drinking quickly can cause pain to the stomach. Exercise at least 20 minutes per day. Take daily vitamin supplements. Attend 1 full year of monthly support group meetings. Carefully tend to your emotional and mental health and ask for help when you need it. Do not use any tobacco, as it can infect the blood vessels in your small stomach and lead to an early death. Avoid taking anti-inflammatory medications, such as Aleve, Motrin, or ibuprofen, without first taking medicine to protect the lining of your stomach. Be careful to limit alcohol to a very small amount, as your new, smaller stomach will speed the absorption of alcohol, and it will have a much stronger effect on you than ever before. If you had Roux-en-Y gastric bypass surgery, this effect is especially strong, as part of your small intestine was bypassed where alcohol metabolism typically begins.
If you have any questions, please call us at 920-720-7211 or email us at bariatrics@thetacare.org.